So next step in this, I think, all-star lineup is Dr. Taura Barr. And Dr. Barr and I go back to at least the first time I met Taura, she was, I think you were still doing intramural research at the National Institutes of Nursing Research, where our Dr. Payne was also doing her research there as well. And Dr. Taura Barr is an assistant research professor here in the School of Nursing. And she's also co-founder of Valtari Bio, which she'll probably speak a little bit about in a few moments. But she's been interesting because her company is a direct derivative of her academic research and understanding sort of biomarkers for stroke triage. And I'll let Taura, Dr. Barr, speak with you about that.
So as Ron gets my presentation up, I want to just take a moment to reflect and speak to the room for a brief minute, because I can sense probably some of you are seeing and thinking, wow, this sounds so very different than anything I would consider doing, or different than anything I've ever learned or even thought about. So I want to challenge you for a moment and let you know that I was that person as well. And every one of you in this room is capable of doing the kinds of things that we are doing. The difference is just the ability to stand up and say, I'm willing to do this, I'm willing to learn, and it's that passion that you bring into it. We talk a lot about passion in the positive side, but passion also gets us through when things are really difficult too. So every one of you in this room can do it. It's a matter of just taking those steps and one step at a time. So as I was putting this together, I actually had fun putting this together. And I thought to myself, you know, I was going to tell the story about Valtari, and I actually left my academic appointment to go full-time in my company. I have 4 small children. We had no money in the company at the time. It was one of the hardest decisions I've ever made, but one of the best decisions I've ever made. And I think more for my personal life than for my professional life. And I'll tell you a little bit about that. So you're going to hear a really personal story from me today. And my hope in this personal journey is to empower you to really find it within yourself, to look at your innovations and look at your ideas a little bit differently. Don't box yourself in. One of the best pieces of advice I ever got from a mentor of mine, who's actually your dean here at Case Western when I was a very young nurse, was, Taura, don't ever box yourself in, because you're capable of doing far more than what all these people are going to come to you and say you can do. And you need to be able to say, I respect that, but I also want to think big and think broad. So that's your job, is don't box yourself in, think big, think broad, and really think about how you can make the impact you want to make in your world, okay? And I think that's my big objective. So I'll put these objectives out here, but it's really more to inspire and empower you. I really want you to take away from today, the goal is to get you thinking. It's to really to get those wheels turning and to really start asking those questions about your innovations and your research program and your ideas. And maybe some of them aren't even fully formed yet, and that's okay. But start thinking about these ideas a little bit differently and put them in this context of innovation and commercialization. You know, kind of what Stephen was just talking about. When we think about our research programs, we've really not been taught to think about this much broader perspective in our research. But I guarantee if I went to every one of you and asked you, why do you do what you do? Your answer is going to sound something like, I want to make an impact in X, or I want to do this for patient Y. And for us to get there, we have to not just think research. We have to be thinking a little bit broader, and we have to be thinking about how can we get this research into the hands of our clinicians and our patients to make that impact. And I think that's where many academics get frustrated, is they're grinding, and they're not making the impact they want to make because they're kind of missing this component. So it's really important. I'm also going to talk about why academia needs us. Every one of you is a potential entrepreneur. I'm going to convince you of that because you're here and you're motivated and you're passionate. And that's what it takes to be an entrepreneur. That's really what it's all about. It's not about training. It's not about expertise. I am not trained formally, but I have the passion. And that's what you need to be an entrepreneur. And that's really what it boils down to. You do have to put together a really good story and a good team, but you need passion first and foremost. Tell you about my story, and Valtari, which is company number 1 and now second company, I've definitely caught the bug and I see the potential and I'm moving these ideas in lots of different places. Describe entrepreneurship, evaluate your inner entrepreneur, and really brainstorm. I'm gonna give you some homework too, to think about how you can do this here at Case Western, because you have tremendous opportunities at this university and you may not have thought about them. And after hearing what Stephen was just saying in terms of the Coulter money that's here, if we had 1 nursing application last year, you recognize that's a fantastic opportunity for you all to get into that space. They're gonna wanna support us nurses. And he already said, we were happy to have 1, we want more. So there are untapped resources in your academic home to do some of this work. And that's the goal today, is to start thinking about that. So I saw this video. Many of you might have saw this video, but I want to show you this video because I feel like it's really inspiring. So I want to just see if it sticks or resonates with any of you. And if you've heard it before or seen it before, please.
Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs in the square holes, the ones who see things differently. They're not fond of rules, and they have no respect for the status quo. You can quote them, disagree with them, glorify or vilify them. About the only thing you can't do is ignore them, because they change things. They push the human race forward. While some may see them as the crazy ones, we see genius. Because the people who are crazy enough to think they can change the world are the ones who do.
So I love that video, because the first time I saw that video, I was in a lecture kind of like this. And I was sitting in that seat and I was, I had all these ideas and I'm like, oh, but I'm not the person to do this. I don't have the skills, I don't have the knowledge. And that video came on and I just felt this inside of me, wow. When you look at all of the people who have made really big changes and really big impacts in our world, they're not the people you would think. They're often the people that just have that passion, and they're the people that are there, and they are the people that are constantly pushing. And it's not change for the sake of change, it's change for the sake of making things better. And I know that each and every one of you probably has that feeling. So I see some heads nodding. So if that video speaks to you, you're probably that person who can really make an impact in a little bit different way than what you thought. And academia needs us, because we live in a culture right now where it's really chaos. We have so much information surrounding us. There's a lot going on right now in healthcare, innovation, and biotech. And academia is kind of at this intersection, I believe, after talking to some folks. There are some universities, schools of nursing throughout the US that are talking about innovation and entrepreneurship a little bit differently, like Case Western, but not many. And what many of these schools are doing is practicing the old way of academia. Grants, publications, we got to get out there and make an impact in this little tiny space. We can't talk about industry. We can't think about industry money. We have to get NIH money because our numbers come from NIH money, right? And then there are those few schools of nursing and academic units that are saying, well, you know what? The future doesn't look like this. The future is a little bit different. We have to be really creative. And how are we going to get there? And when we think about I could go on, we could probably continuously add to this list of why, but there's lots of reasons why we need entrepreneurship and innovation in academia. But we have a bit of a problem, because often the academic process hinders entrepreneurship and innovation. And I lived this, I know this, because my first faculty appointment was at West Virginia University, and I was working towards tenure and promotion. What's important for tenure and promotion? Grants and publications, right? if you're building a company or thinking about building a company, you don't want to publish. You have to protect your intellectual property. You don't want to submit grants because not everything is grant fundable. Validation studies are not funded by the National Institutes of Health, but you need to do these kinds of studies to get your product out into this commercial world. So I very much sat in this, okay, I know what I need to do for my product and my innovation, but I got to meet the needs of tenure and promotion. And there's only so much time in the day. You only have so much energy. And so we're often in academia writing grants for the purposes of getting grants to fund our tenure and promotion process, or this funding agency has this need, so I'm going to shift my research a little bit so I can meet this need to get this grant funding. Did it many times. You know, we live in this world and we have to survive in this world, but it very much can hinder entrepreneurship. And conflict of interest. I became very frustrated with this concept of conflict of interest because we all see conflicts and say, oh, we can't have them. That's not right. You have to manage them. It is okay to have a conflict of interest, but it needs to be appropriately managed. So it's a different way of thinking about our work that's really uncomfortable sometimes in the academic setting. And there are some things that we can do, and I will say that your institution here at Case Western is really thinking about them. We're moving progressively in that direction. But the number one most important thing is to identify your bias and check your bias. Because there are many academics who have a very negative bias towards innovation and entrepreneurship. And whatever that bias is, wherever it's coming from, it needs to be identified by that person. And essentially, okay, here's my bias. This is what I bring to the table, because we all bring these biases to the table. But we have to be willing to let go of them and to meet the future and walk in that way together, because these biases will hold us back. Tenure and promotion is another big one, because I can tell you all of my colleagues now that are on that tenure and promotion pipeline that have either just been tenured or promoted, they're about fried. They're kind of at that point of, oh, wow, what just happened to me? Their energy is like this, and they're at that point in their career where they should probably be taking that next stage, but they can't even think about it because that tenure and promotion process was so rigorous. And so tenure and promotion guidelines are designed for academia. They're not designed for innovation and entrepreneurship. So it's something to keep in mind. And I would pose the question to you all, what do you think we need to do to innovate and support entrepreneurs? Because you probably have some ideas about being here at Case Western. So I would like to just, if you have any, if anybody's willing. Yes.
I think exploring industry-funded endowment and scholarships for common research interests.
Yes, could you repeat that for the folks? Yeah.
I would say exploring industry-funded endowments and scholarships for common interests that are shared.
That is a great idea. And maybe something, Ron, we were talking this morning about where the school is trying to go in this component, in this arena. That's a great suggestion. One to take a good note on, yeah. So we're going to do a little bit more brainstorming throughout and at the end. And the goal really is to get you guys thinking and to start creating something here, really creating a conversation here at Case Western. That is the goal, is to create the conversation. So, as I said, when I was putting this together, I thought, okay, how could I tell my story? Because my story is interesting and it's very personal. And I've shared my story on numerous occasions, and I have had some healing as I share that story, but I've also touched the lives of others when I've shared this story, because I was the academic. I was the epitome of the academic, doing everything for everyone. I had a small family. I had a lab at WVU. I was a co-founder and creator of a new center at WVU in our stroke center. And I was just running, nose to the grindstone. I had NIH funding, Robert Wood funding, DOD funding. I was doing everything, right? On the surface, I was very successful. I was the academic success. This is where you're supposed to be going. I was on that tenure promotion timeline, but internally, there was really something missing. And it was just this constant, everyday battle for me to come to work and do what I knew I needed to do, but I wasn't making the impact I wanted to make. And then I got hit by a cosmic 2x4, divine intervention, if you would, okay? I was 12 weeks pregnant, and I'd flown for 3 months in a row. I was getting ready to go to Bethesda for DoD grant reviews, and I had severe chest pain, couldn't breathe. And I thought, okay, I'm pregnant with my 4th baby, and I'm doing all these things. I'm just tired. But I said to my husband, I don't know how I'm gonna make it, so you're gonna have to drive me. We get in the car, we make it to Friendsville, Maryland, which is about an hour, and I'm coughing up blood. Long story short, I had a pulmonary embolism. I landed in the emergency room, had some complications, went home. I had an MI, I passed out, woke up in the back of an ambulance, and for about a year, I was just trying to survive. And I couldn't think about anything other than just me surviving. And I actually was ready to quit my job. I was ready to give it all up and be a stay-at-home mom because it was so powerful. That event was so powerful. I had everything, quote unquote, everything was taken away from me. I couldn't even walk up my stairs. I had to go in cardiac rehab. I discovered I have a clotting disorder. So it was kind of all these things coming together. I'd studied stroke and cardiac disease, and now all this stuff is coming together. And I thought, oh my goodness, what am I supposed to be doing, Rob? I fell into a support group that was fantastic. And through that support group, I got the coaching and the mentorship I needed. And I recognized that that experience was really to propel me in this arena, to remind me why I got started in nursing. I was a nurse long before I was a nurse. And I decided that I wanted to make an impact in stroke before I even went into nursing school. So I had this calling, and I wanted to make an impact. And this experience was almost like this wake-up call to say, you only have so much time. What's calling you every single day, you're not doing. You are meeting the needs of your tenure and promotion committee, you're meeting the needs of this and that, but you're not doing what you really are called to do. And it was causing a lot of frustration for me. And it's what got me back to work. And when I mean this and I say I was ready to be a stay-at-home mom, I was ready to quit and just say, all right, Bobby, my husband, we're figuring this out, but I'm not going back to work again. And I now have a much different perspective on my career, and I'm also very passionate about paying it back to others that are in that same position. So when I think about where I am today, this event, although it was semi-disastrous, it really set the stage for where I am today. And what I did was I created Valtari Bio out of that disaster. So SaraDX was the company that I had, quote unquote, created before this happened in 2012, but it was not the company that really I'm gonna talk about today. I came back after that event. Well, it was 2013. I came back to work in 2014. I was out for about a year and just kind of hit the ground running with Valtari Bio. And then I left my academic appointment about a year after that to be full-time in this company and really launch this company the way that it needed to go. And what I decided to do here was give you a semi-modified pitch, because where we are as a company is we are seed financed. We've had about a little over $3 million in seed financing from what we call angel investors, which are early stage investors. And we are actually transitioning into our Series A financing round of about a $10 to $20 million round that we're going to pull in tranches. And I have learned so much about myself in this process. And most importantly, when we go back to Stephen's presentation and you know, what we heard this morning from Dr. Bowles, you've got to understand the market and where the need is. And what I want to bring to the table, to talk to you a little bit about stroke and what I'm really passionate about here, is this notion of stroke triage. So if you can imagine that you're in the pre-hospital setting, you're a paramedic, you're EMS, you maybe get 1 hour of stroke training a year, okay? And that's very brief. I'm gonna give you these questionnaires, and you have to be able to identify whether a patient is a stroke in a matter of minutes. Most strokes are relatively mild. They look like other things like migraine and intoxication. So what happens is patients are mistriaged in rural settings up to 60% of the time, 6-0. patients are being mistriaged. What happens when patients are mistriaged is they're sent to the wrong facility. And in stroke care, we actually have 4 different echelons of care. We have comprehensive, primary, stroke ready, and community. Now we have this whole other embolectomy capable definition. I don't even say it right. I can't even get the words out right. But we now have 5 different levels of care. You're a pre-hospital provider. This is not your level of expertise. Where do I send this patient? Patients are going to the wrong places. Time is brain. So if you're looking at these cases, what tends to happen is that young women and minorities are misdiagnosed at much higher rates. And they are missed because we tend to think they're either migraine or intoxicated. And it has been our goal to get out there and get rid of this subjective assessment, because what these clinicians are doing is they're using scales, maybe 3 questions that they ask these patients to determine whether or not they think they're having a stroke and where they should be sent. Very subjective. It's based on clinical expertise and the patient's symptoms. That's why we're getting it wrong a lot of the time. So this current diagnostic path really relies on the expertise of that pre-hospital clinician to get this right. And we know that in a place like Case Western, there was some work done at Cincinnati. Even there, the stroke teams that are called to the emergency room get this wrong up to 30% of the time. These are guys who are trained in stroke, but still make this initial triage decision based on symptoms alone. And they say, okay, I think this patient needs to go to MRI or CT, or I need to call the stroke team. So if you can imagine that that mistriage is happening in educated institutions, what is it looking like in the pre-hospital space? And the burden of stroke mimic, is relatively unknown. There are about 3 million people per year in the US alone that approach the ER with stroke-like symptoms. Only 800,000 of them end up having strokes. So 2.5 million patients are essentially being seen or worked up for stroke mimic who do not end up having a stroke. It's a huge number of patients, a lot of time, and a lot of resources. So what we have done over the course of, we'll say, a little over a decade, my academic career was on the use of innovative biomarker profiles to understand the physiology of stroke. I never imagined I would be using them as a triage diagnostic, but I was really fascinated with the immune system and how the immune system plays a role in stroke and brain injury. And what we discovered after those studies is that there are patterns of the immune system that are actually quite diagnostic for acute stroke triage. So we are now taking those profiles and we are placing them on point-of-care diagnostic device. And essentially what we will have, hopefully in the next 5 to 7 years, if we make it, is a device that will sit in the back of an ambulance. It'll look like a glucometer from a whole blood, small volume sample. The clinician will put the patient's sample on there. In a matter of minutes, he or she will get a yes/no probability of stroke. And that and some other pipeline products we're creating. But that will then create the foundation for where do I send the patient? Do I bypass the community hospital to get them to a comprehensive, or do I send them right to this primary? There's lots of stuff going on right now in American Heart Stroke Triage. So going back to timing, the timing of this is perfect. The AHA just put out triage guidelines, pre-hospital triage guidelines. Our goal is to get into these triage guidelines at some point in the future. And as I said, when we think about stroke, the immune system is really an untapped resource. Very few clinicians actually use the immune system in terms of their, treatment, as it will. But we know, and we've done some studies, but other folks have done some studies, the health of the immune system is really critical to how the patient will recover. And we can tell the patients who are more likely to die or have poor outcomes just simply by looking at something like the neutrophil lymphocyte ratio. If that neutrophil lymphocyte ratio is out of balance upon admission, the patient is more likely to have poor outcomes or even die, regardless of severity or treatment. And we don't use that. That's something clinicians don't use. Number 1 cause of death post-stroke, anybody know what this is? Infection. Infection. The immune system, patients are immune suppressed. Do we teach patients this? No. So there's quite a divide between what we know about the immune system and how we're actually using it in clinical practice. And our goal as a company is to bridge that divide, bring this information to the clinician and the patient. And some of it is so simple. Hand washing. Stay away, if you've had a stroke or a heart attack, stay away from folks who are sick. New England Journal, if you have had the flu, you're at an increased risk of heart attack and stroke if you have risk factors. These are really simple things we can start telling our patients and telling our clinicians that are data supported. But we're not currently doing them. I get all fired up about it because it's, it's right there. It's so right there, but we're just, it's infection, right? And we're just not doing, it's not sassy enough. It's not interesting enough, but it's real and it's something that can be used to improve patient outcome. So our diagnostic path with REST, our Rapid Evaluation Stroke Triage Test, looks something like a quantitative assessment of stroke potential and then immediate transfer to where they need to be if they're in the pre-hospital space. If they're in the emergency room, it's time. We're gaining lots of time here because that initial triage is typically done by nursing or an emergency physician, and then the stroke team is called if they're not initiated upon arrival. So there's lots of questions going on at that initial triage, and we want to take the bias and the subjectivity out of that and use this objective measure of the potential and set the stage for that early on. And when we talk about what our success looks like, I always have this conversation with our team because when you're in a company, you obviously have to talk about the money. The money is what will drive this. But what drives it for me is the potential of making this impact. And so when we think about mitigating risk, we are improving patient diagnosis, we are improving triage. In addition to doing those things, we're also going to save a lot of time and resources. And that is the pitch, essentially, when we're going out and we're talking to these investors and we're talking to our partners, which are really insurance companies. It's not just this possibility of having these improved outcomes, because we know we will have improved outcomes. We have to show that. We have to do these studies. But we also know that we're going to save time and we're going to save resources. And as I said, where we are in this process is we're really early stage. And we've made it, I want to say, like on that valley of death, we're kind of like 1/3 hanging out there on that bridge with like a toe hanging over the edge. There are days where I'm just convinced it's not going to work, or, we're not going to raise this money, and what am I doing, And then I have days where it's fantastic, and it's the life of a startup is a roller coaster. And you have great conversations with investors, and you have really bad conversations with investors. And you walk into these rooms, and you just never know what you're going to get. And most of the time, we've had some really good feedback. We know that we're on the right path, and we're just going to keep on going. And we're actually building our team, our clinical trial team. We're doing a multi-site trial as we speak, and part of that multi-site is the foundation for our FDA trials. We're going to be partnering with enabling technology company really soon to create a prototype. So we're doing all of the right things. We're kind of moving along, but I can tell you from a personal standpoint, it's really difficult, and it's a whole other level of questioning yourself. When I was in academia, I had that feeling of imposter syndrome a lot. And now it's even worse, because I'm a nurse from West Virginia walking into a room of investors, and I'm going to tell them why we are really important and why they should invest in us. And so I always have that, maybe I'm not the right person. Maybe it should be somebody else doing this. But then I'm reminded, I have these kind of interactions, and no, Taura, you are the right person, because you are the passion. You're the passion. You're bringing this, and you're bringing that patient along with you. You're bringing that clinician into the room. Nobody else is. Everybody else is talking about the money. So if I'm not there, then we miss that patient component. And I think that that's really important when we talk about, when we're talking about the things that we're doing, that's really what's driving me at the end of the day. And it's hard. It's hard to stay in those conversations. So I can't talk about this without talking about our team. And I co-founded with two other co-founders, Richard Gersh, who is our CEO and chairman of the board, and Valerie Jonas, who is our operations officer and president. And these two people have just become really critical people in my life because we spend a lot of time together. We sometimes disagree, but we disagree in ways that are good because we don't think the same. We're not always thinking about it in the same way, and that is what is required of a successful company. If you're all thinking the same thing and you're going in the same directions, sometimes you miss really big things. And so we all come at this from a very different background. Valerie and Rich both have business background. Valerie has a lot of marketing background. Rich also has some research background. So we're pulling together very different components. And what we've done is we pulled together some other board members, critical investors, angel investors who've kind of been there, done that, and then some other folks on our scientific advisory board who have also kind of been there, done that, tried to do these things, and they have just been critical in this process. So in the last few minutes, what I'm going to do is tell you a little bit about what now I'm hoping to do next. And, Jen and I were just kind of briefly talking about this. Once you step into this world and you recognize it's really not as scary as you thought it was, and it's really kind of fun. I mean, there are days, obviously, where it's really difficult, but it's really kind of fun. You say, wow, I could do this, and I can do that, and I can do this. It's really scary for my husband, of course, and my family. But at the same time, there are so many opportunities. We have so many opportunities to make impact. And so the next stage, and I will say that this is still very early stage for me, and it's something that I'm doing in addition to my role in Valtari, because when I talk about this passion component, and I know I've said that word a lot, but it's really what drives me. Why do you get up every morning and do what you do? And that's what's going to bring you to the table when things are difficult. Because otherwise, you could just go your entire life and be completely unhappy with the work you do and not feel like you're making an impact. I've had some critical life experiences, personally and professionally, that I recognize could really help others at certain points and junctures in their life. And as I've been out, I've done some consulting work in academia, I've had lots of folks talk to me and say, you're so positive, you've been able to get through this with a small family, and you're building a company, and you're still doing, how do you do what you do? And I, in my mind, I'm like, I don't know, I'm just doing it, right? But there are critical components to my life that I've put strategically in place to support me. It doesn't just happen, and it doesn't just happen overnight. And so now I'm dedicating a part of my time to aid others who are in that same situation. They're either in leadership or they're returning back to work in life after critical experiences, and they're really looking to balance to sustain their careers. So they don't get to the point where I was like, that's it, I'm done, I quit. I can't do anymore. Because we need you. We need you in academia. We need you out in the world. And when you're not doing what you're called to do, a lot of folks are missing out. So I want to be there to support. I don't know what this is going to look like, but I would love to talk to anybody who's interested, because I'm really passionate about this piece right now. So we're good on time? We're good on time? Okay, perfect. So what I wanted to show you is, I'm going to brag a little bit. These are my two little girls. And as part of Deep Roots Healing, also what I'm really passionate about is I've lived very different lives. I was a professional and did not involve my family in that work at all. And aside from me telling them what I did, maybe taking them to the lab every so often, I very much divided my professional and work life. Everybody talks about work-life balance. There really is no such thing as work-life balance, okay? It is a myth. It is just your life, okay? It is your life, okay? So you have to figure out a way to make your life your work and your personal. And so I'm having so much fun with Deep Roots Healing because I am including my girls and my family in this process. And this is us at a health fair. And we were, just talking to folks, and my daughter was telling somebody about their blood pressure, and, oh, you can drink this hibiscus tea for blood pressure. I'm like, this is fantastic. So the idea of entrepreneurship is that anybody can be an entrepreneur. And I see it in my daughters now. You see a problem, and you say, oh, there's a better way to solve that problem. Why are you doing it this way? This doesn't make any sense. Why don't you do it like this? That's entrepreneur, that's innovation right there. Kids do it all the time. They question the status quo. We get frustrated as parents because they're questioning us. But if you really look at it and you really think about it, that's what entrepreneur, and we tap it out of our kids. We don't like that questioning. And we have a generation up and coming that is very different. And they're embracing this. I don't like the status quo. We need to fix it. We need to change it. And we need to really start listening because there's a lot of nuggets in what they have to say. Entrepreneurship is really not about your expertise. It's not about what you know. You can learn it. It's not about the skills. You can learn the skills. It's not about what you give up to be successful either. I think there's quite a bias when most folks, when I talk to them about what I do, they say, oh, you must have had to give up family time, or you must have had to whatever. I have gained so much in this process. I have not given up anything. What I gave up was this idea that I was an academic tenured professor. That wasn't really what I wanted anyway. That was just what my culture and society had told me I wanted. And that was the world I grew up in as an academic. That's just what you do. You aspire to be a tenured professor. And when I recognized in me that that wasn't really what I wanted all the other pieces, but that wasn't the end all be all for me. That was really critical. So it's not about giving anything up. And it's really not about winning either, because you're gonna fail a lot. And you're going to learn a lot from those failures. It's about being of service and being of value. And that's what entrepreneurship is all about. So you can create within academia. It's called intrapreneurship. You can create within any institution as an intrapreneur. It has its own guidelines and rules. And you can create outside of academia, which is a whole other playing field. And I've been in both, and I somewhat understand both of them. I'm still learning, and I think this is going to continuously be for the end of my career. It's a process. And the whole idea is to be comfortable with the uncomfortable, recognize that plans change frequently. You can't be so set in your research or in your ways that you're not willing to change, because if you do, you're going to miss the boat. It's going to take off, and you're going to be standing there on the shore not knowing what to do. So we, as a company, even in Valtari, have thought about our product differently over the course of 3 years and really kind of shifted according to what the market need was. So you have to be willing to do that. And you really just have to take the leap. I mean, I think that's probably first and foremost. I'm the worst one at this one, because I sit and I overanalyze, and I think and I think and I think and I think of everything that could go wrong, everything that could go right, and got to have a plan for this and a plan for that. You need to have a plan. You need to have an idea, but you cannot overthink it. You just need to take the first step. And if you're going to fail quick, because then you don't lose a lot of time. And you learn from that failure, and then you just stand up, brush off, and you just go again. And that's what it takes really to be an innovator, is to not be afraid of failure. And you can't be afraid of other people, I've been watching my colleagues who are getting promoted, and my colleagues who are getting, all these NIH grants. And so if I focused on that, I would be missing the opportunities I have in my company. I'm not going to say I haven't thought about it, but I don't let it stop me. And those are the critical components, is to recognize who you are in the process and move through that. Okay, so we have a few, I want you guys to take these with you as you're thinking today, and ask yourself if there was anything you could change at Case Western School of Nursing that's getting in the way of you being an innovator or an entrepreneur. Really think about this and send them to Ron. Because I think what I'm hearing from your leadership here is they want to remove these barriers. They do not want to be a barrier for you to be an innovator. They want to be a facilitator. And they don't always know what's out there holding you back. So really critically think about this. Is it your teaching load? Is it your service load? Is it the tenure promotion guidelines? Are there certain things that are happening within your environment, your world, that are actually making it really difficult for you to do this? Maybe you need another mentor. Maybe you need more, faculty. And leadership. Maybe you need some leadership that is thinking about this differently. And when I think about leadership of the future, I'm kind of working on this idea, and I was going to talk to Jen about this. It's something I've been thinking about. There's a different leader that's going to be required in our schools of nursing in the future, because there is so much untapped potential in our schools of nursing. It is phenomenal. When you go out and you start talking to what you all are doing, not just at one unit, but we have so much potential. We have so much potential to make an impact. The problem is we often don't think we're the ones that should be doing it. We often think, okay, maybe I should give it to this person or give it to that person. Then we lose that credibility, and then it's taken over by someone else, and then the passion's lost, right? So I think that we are in this process of change, and as I had said earlier, there's a new generation of millennials that are up and coming, that busyness is a thing of the past. It's not cool to be busy anymore. When you're talking to somebody and you're like, oh, I'm so busy in my schedule, I have no time for that, you're kind of like, oh, well, you need to figure out time, because you got to figure out how to make this work, right? And it's not just this busyness, it's also efficiency and minimalism. We put so much around our faculty, and we have so many committees and so many groups. Less is more, and we need to embrace that in academia. We really need, if we truly want to leverage this up and coming generation. We need to walk the walk. So I'm going to bring this right back to what I'm doing in Deep Roots Healing. So when I decided to come back into the world of the professional world, I made a commitment to my health and my well-being. And what that looks like is saying no to the things I should say no to and yes to the things, and being really clear about that. My morning time is my time. I do not schedule meetings if I absolutely don't have to in the morning, because I need it to recharge. And when we look at our schedules, we talk about this all the time, time management. It is not about time management. It is priority management. So when you're looking at your schedule and you have that feeling at the end of the day where you're like, oh, I've not done anything, I'm overwhelmed, I guarantee I know why. It is because you are doing everything on your schedule and nothing to address your priorities. So there's a disconnect. There's internal conflict there. So when you're feeling that way, you have to take a step back and reprioritize and reschedule. Get rid of things, say no to things, and recognize that if you want a sustainable career, this is a requirement. It's not just an option, it's a requirement. So it's walking the walk as leaders, which we sometimes have a really hard time doing. So now I've gone over a little bit of time, but this is for you to take and to really think about, because here in Cleveland and Case Western, you have a lot of opportunities. You live in an environment geographically that is prime for innovation and entrepreneurship outside of your academic unit. We've not talked about that today. So think about the businesses and the opportunities outside of Case Western here in your local region that you can leverage to support some of what you're doing, because I guarantee there are a lot of them. And you've not really thought of them in this component, but they're there and they can facilitate a lot of what you're trying to do. And please do not box yourself in. And when you start feeling like you're in that box, here are some things that you can do to get out of that box. Spur your creativity. So go take an art class, go on a retreat, talk to a child and ask them what they would do. Read a book. And I know all of you are like, oh, I don't have time for a book. You have time. You just have to make it. And recognize that your well-being, your success as a leader and professional is dependent upon your well-being. So first and foremost, put your oxygen mask on. Get yourself to the point where you're capable of being the best leader you can be. And then you're going to create and innovate fantastic things. So I leave you with that. And think about which path you're going to take. Is it going to be this nice, clear path, or is it going to be this one that's fun and adventurous?
Thank you.
Yes, thank you.